1 year time. Another really important thing is they're going to tell you when you get this mammogram, you may need to do a diagnostic mammogram, which is different from a screening mammogram. I know, it makes you kind of nervous, but the screening is just a general squashing the breast, whereas the diagnostic, they put a lot more pressure so that they can see if there's some abnormalities. They may also have you come back to do an ultrasound of the breast. And I know when you hear that phone ring and go, you need to come back, it may make you scared and nervous, but I guarantee the majority are usually cysts and dense fibrous cystic tissue. So please go and get those tests done. And as you can see, I'm a survivor. I'm here 3 years and going. So please don't avoid it. Early is better than late. And the final test, because we are in March, it is colon screening month. Please, if you're over the age of 45, get your colonoscopy. And before the colonoscopy, you can do the screening card, and there's a new test. There's a blood test to check for colon cancer. Ask your doctor about it, but do get it done, because it used to be 50 that you had the colon screening, but we're finding more and more people, young people, who are getting colon cancer, and yes, it can be treated if found early. So I definitely am recommending those 3 things for women. It's Women's History Month. Get your PAP, get your mammogram, and get your colon screening performed. And I'm so happy now. My guest is here, our Councilwoman, Katrina Wilson. Come on down. I'm excited to have her here. It is Women's History Month.
Yes.
I'm glad you were able to come.
My pleasure.
Councilwoman Katrina Wilson, if you don't know her, oh my gosh, there's just so much to say, but I've had the opportunity working with her these couple of months, lots of amazing things. She's in her second term here at City of Miami Gardens. She's an educator, councilwoman. She's working on the women's committee for Miami Gardens, currently working on Juneteenth.
Yes, I am.
And she's busy.
Yeah.
She's busy. So the fact that she came to us today, I so appreciate it. And we are in History Month, Women's History Month. And could you tell us what motivated you to go into working on the council, and what was your impetus?
I have always been a public servant. Education, although it is a profession, so much of your work is really about working with children and families to help them realize the dreams that they have for both themselves as well as for the next generation of that family, which is their children.
Yes.
And so being able to articulate how they can achieve that through what I teach and what I represent in an educational institution was really how I really got involved with public service. Because educators are public service, and anytime you do anything outside of the classroom, it automatically becomes more than just education. It becomes public service.
Yes. And you're doing an amazing job. But you're on a committee that is so important. They say, the hand that rocks the world is a woman, and in our community, what have you seen being on the Women's Committee? What have you heard are the things that are affecting women in our community?
We like a year or so ago, we had our conference where we assembled pretty close to a couple of hundred women from a range of ages, from the teens all the way up to our seniors. And just as the age range was wide, so were the concerns at every level. When we took a look at our seniors cited as being one of the most important things to them, and that's clean food. They felt that the stores in our community really did not offer them the level of food choice that they felt would fit their needs. As you age, your health concerns are very, very important to your overall mobility and both physical as well as cognitive, and being able to have access to clean food was a big issue for them, right? They also were concerned that when you look around in Miami Gardens, the number of healthcare facilities, whether that's urgent care, hospitals,
Yes.
and things of that nature, doctors' offices, they are all well below what you would
Yeah.
find in most communities with the same
Number.
population,
Yeah, we have
right?
110,000
That's
here.
right, 20,
And we can
120.
count probably on one hand the number of healthcare facilities here.
That's right. That's right. Those were big issues for them. Our seniors were also very, very concerned about not only health care, not only food, but also access to supplemental income. You know, like supplemental income really in terms of how they take care of their own homes.
Right.
As you age, you know, running a house becomes a very expensive proposition
Exactly.
because you're on a fixed
Fixed income.
income,
Fixed
and
income.
and so they were saying, well, where's the senior living?
Yeah.
You know, how can they transition from their single family home into a little bit more comfortable environment where people in their own age brackets are, where they would have concentrated focus on the kind of services that they need.
One of the things that in communicating with the elderly and seniors that has come up is, and there's an organization called Grandparents Rearing Grandchildren. It's quite the norm in our communities where grandparents are raising grandchildren.
Absolutely.
And that fixed income really has to stretch
Yes,
to
yes,
take
yes.
care of these kids.
It gets eaten up.
It gets
And you know, like currently in the times that we're in, where so many of our social services that come from the federal government are being wiped out,
Yes.
then now we're going to have a problem that not only will children not be receiving any supplemental income, but neither will the grandparents.
Go the grandparents.
And so then what does that mean? That means that poverty then becomes and starts to seep into people
Yeah.
that were middle class or lower middle class people, but who were able to be self-sustaining.
Yes.
Now, without any of the supplement to help them transition to a better quality of life, it gets to be pretty hard.
Yes. And you know, as
But
they
let me say something
Sure.
else that's a problem with our seniors, right?
Yes.
When I was growing up, my grandfather could not read or write.
Yes.
You know, he grew up in rural Georgia and he came down here to South Florida, hitchhiked his way, trying to find a new life.
Yes.
And so as a result, my grandfather couldn't read or write because the schools back in segregation in rural Georgia, they did not have any.
Right.
Well, we have a different type of lack of education that is creating a dichotomy for our seniors, and it's called technology.
Technology.
Yeah.
Many of our seniors, and you know, we say seniors, but it's quite a range. I've seen many people 45 and over. Many of the technology, our hospitals are requiring portals to access medical records. They're going to doctors' offices, and they want you to check in electronically, and
That's
they're
right,
doing
that's
away
right.
with the paper system that many of our seniors rely on, that they figured out how to do.
How to do it.
So
That's
you're right. There's a large illiteracy in the technology-based
That's right.
system that we have moved into.
That's right.
And those are the services that the training that I'm glad that we in Miami Gardens are starting to impact the community. We're doing it at the senior centers. They have classes, and also in the library they're giving classes. But for families are having to get involved.
And I think that what is happening, and you're the doctor, not me, but I want you to probably look up these statistics. You know, women generally, traditionally outlive men.
Yes.
But what we're finding in our community is that that's changing.
Yes.
Where women are being subject and are not living as long as they used to.
Yeah, we've
And
found that.
primarily the indicators that affect that is taking care of another generation.
Another generation.
And the stress that's involved with
Yes.
that now, because they can't read or write, or they can't, they're technology illiterate.
Yes.
All of that's impacting on it. And there is also a lack of connection with the younger generation because they are more on their phones,
Their phones all the time, yeah.
than they are doing what you and I are doing, and that's having conversation.
Yes. What I think that's such an excellent point that as we move into technology age, we're seeing this abyss being created and the stress on the woman because they call them the sandwich generation. The sandwich generation is the generation of, and I have to say women, because we have been the caretakers who are now taking care of kids in school
That's right.
and now having to take care of seniors because, as you said, the technology. So I have patients who are not going to their own doctor's appointments because they're taking their work time off to take a parent to the doctor.
That's absolutely correct.
And it hasn't to do with the actual doctor visit as it has to do with the technology that they have to go through
Mm-hmm.
to even set up the visit, even the medications that they have to pick up. It's coming on your phone now. If you ever notice, many of these pharmacies are sending messages to phones. Oh, your medication is ready.
Ready,
It's
text
ready.
messaging you and all of that.
You have
and,
appointment on this time, and so these sandwich mothers and caretakers are having that stress
Right.
and not taking care of their own
and,
health.
and so then the stress then breeds mental illness.
Mental illness.
It affects the mental health, and many seniors get depressed as a result of it. And so then their depression becomes contagious if they are the caregivers of a younger generation. And so we are not prepared, and we don't have a way to segue from one generation to the other, and to being able to be caregivers of both mothers, grandmothers caring, and grandfathers caring for grandchildren, and then the grandchildren being prepared to reciprocate.
Yes.
You know, so that's tough.
I'm so glad you brought that up, because next month is April, which is stress month, stress awareness month, and in May is also Mother's Day, but it's also mental health awareness. We will be hosting a mental health symposium on the 10th of May. Please come out where you can learn some coping skills. And starting on Saturday at the Senior Center, we're hosting a Boundaries for Teens. If you have a teen that is having difficulty creating boundaries in their life, please have them come out and participate in that event. But let's go back to you, because you are a powerful, and now you are in history. You are now in history as the councilwoman here. Tell me about who motivated you. Who was your icon?
My icon is been my mom.
Wow.
My mom and my grandmothers and you know, the women in our family. You know, here in the South, when you deal with African American women who are Southerners, who grew up as agriculturalists, they were doers. You know, they take care of their families. They had traditional values, you know,
Yes.
from the South, and they had have a can-do attitude. We just recently celebrated the 80th birthday of my mom.
Wow.
And my grandmother was about 90 when she passed away.
Whoa.
And so much of the legacy of those women, you know, just stick with me, because although my mom worked a lot and my grandmother, you know, didn't have an education, they understood the value of family, and they understood the value of raising women, because I have 4 sisters, of raising women who were able to ... And so part of it was education. Another part of it was worship. Another part of it was working hard. Another part of it was service. Those things were things that we were raised to do, to be involved, to be productive citizens. All of that nonsense of sleeping late, When you got
Get
up
up
on
out
the
of bed,
get out of the bed, these
clean
clothes
that
got to
house, these clothes gotta be washed
You
and
can't
folded
go out
and
there
put
and
away.
Oh, so that was your mama too?
Mm.
All right, all
Look,
right.
she gets up at 7, go to the supermarket, and at 7:30 she's rolling in. Let's go.
Yeah,
Get these
yeah,
groceries
yeah.
put away.
That's exactly the way it was in my house. And so I had role models that I grew up with, that I loved, and that loved me enough to spend time with
Yes.
me. And so for me, I think the things that I learned, I didn't have to spend the entirety of my life.
Yeah.
I got the wisdom, and I got the lessons, and I got the supervision right there at home.
Wow, that's fantastic.
Mhm.
That foundation, there's nothing than a good foundation.
No,
And
no.
more importantly, learning from the foundation, because there are people who have great foundations and don't incorporate it into their life. And obviously you have, because of the great work that you have done. And Councilman Wilson, tell me, if you could speak to this generation, what 3 pearls would you give them about the history of women and what meaning they can take away from it? If you could give them 3.
Well, one, I would say, just because something old doesn't mean that it doesn't have use.
Ooh, I love that. Just because it's old does not mean it has
doesn't-
no use.
Right. Taking time, you know, I tell my son this. I say I have the answers to a lot of questions in the test of life. And you don't need to live all of life, you know, in order to understand it. Let me tell you some of the things that will save you some time, so that you can go ahead and bubble it in life, and then spend your time on doing things that you have no knowledge of how to get it, because pretty soon you will look up and time will have ticked down and you'll be trying to figure out how to make cornbread when I told you this was the recipe.
This was a recipe.
Yeah, so,
You know,
so
trying to do a Google search when you got a woman in the house
that-
already here to
who-
show you.
Here to show you, and has the goods, has the
Yeah.
resources that you can utilize that you don't even have to purchase. You can save your money to do something that you
Yes.
haven't done before,
Right.
that nobody has the answers to, and you can spend a lot of your time focused there. So I think that what the younger people should do and the older people should do is spend a little bit more time together, like we're doing, having a conversation.
Yes.
You know, talking, and, not, and you know, I've learned that one of the coolest things in the world is to disagree.
Oh, yes.
Yeah, to disagree. And the reason why it is, like, a lot of people, when they disagree, they become angry.
Taking
And-
it personal.
Yeah,
They take it
yeah,
personal.
yeah.
Taking it personal.
And instead of saying, well, you know what, I disagree with that fundamentally.
Right.
But guess what? If what you think is right ends up being wrong, you still have another way you can try.
You can try.
Even though you didn't disagree with it. You know, it's just like okra. I did not like that cotton picking okra for nothing in the world.
Slimy,
And all that
yes,
old
I remember.
nonsense. And then one day I ain't had no money.
Okay.
And so I went in the grocery store and the okra
Okra.
was there. And so I cooked it. And I found that what I thought I didn't like was good enough. It was good enough
And good
to
for you
feed.
too, because it's a green, and greens are good.
See that?
Okay.
But you understand?
Of
I was
course.
refusing something that was even good for me.
Exactly.
You know? So
I
I
like
think
that.
that, like, a lot of times what we need to do, both young and old, men and women, we need to listen to each other. We need to respectfully disagree. And then sometimes as we get down the line and we figure that, hey, maybe I can use this now.
Yes.
Even though it wasn't useful to
Well,
me.
then.
Right.
Yes. So we have old does not mean it's useless. We have two that disagree, but don't be disagreeable. You know, there's pearls to be found in every conversation, every discourse. And what would be the final thing that you would give as something to take away
To women?
to women? Yes.
Yeah. I think that, you know, in the course of the last 50 years or so, we've spent a lot of time outside of our homes, building our careers,
Yes.
becoming educated, becoming wealthy, becoming independent. We've spent a lot of time there. I think that maybe we need to go back home.
Go back home.
And spend a little bit more time with our families, with our children, with our mothers and our fathers. And the reason for that is that family is an extremely important foundation
It is.
to life.
Yes.
You know, and we've given that up. And when we're out there, we think that people that are complete strangers are better to us, and they're not. You're gonna disagree. You know, you're gonna. God made us, didn't He?
Of course.
But we disagree with Him, don't we?
All the time.
Okay, that's what I'm saying. We
Yeah.
disagree with God sometimes, so of course we're gonna have disagreements in the human side
In
of
the human
things.
things.
But there is nothing like people who love you
Yes.
and care about you. And care about you enough to tell you that
Tell you
they
the
think,
truth.
oh,
Tell you
there
the
we
truth.
go.
There's no
There
truth
we
like
go.
the
There
family
we go.
truth.
That's right, that's right. And so for me, I know that no matter what, even when this is over, I'm home.
You still have home.
I'm home with my family. I'm home with my son, my mom, and my cousins. I still have a place that I can call home. Even when I leave the city of Miami Gardens and I go to Atlanta, New York, Washington, D.C., California, I have a place called home.
Home.
You know, where
Yes.
you know me, and
Yes.
like Cheer says, where everybody
Everybody
knows your
knows your
name.
name.
You know, and so I think
Exactly.
that we have to be willing to take pride in that, and part of that is us being able to sit down, you know, and like you're doing, and being able to talk about the health issues that maybe we're just
You've been
ignoring
hiding
it,
and
you
ignoring
know.
and hiding.
Right. And that is what's going to cause us not to be with our children, because we'll be sick.
You'll be sick,
Right?
yes.
And so
And
if
become
we,
that burden that we don't want to be.
we don't want to be,
to
you
the
know. I
generation.
mean, you know, like I was saying, the elderly, they're hurt because they're used to being independent.
Yes.
And so when they can't do things on their own and they look into the eyes of someone who doesn't want to be bothered with them,
They're depressed and
then
then
they
they're
want to
hurt.
die.
Then they want to die.
Yeah, they just say, I don't really want to live no
Exactly.
more.
And they're treasures.
They
There
are.
are treasures, and they have
are.
pearls and wisdom.
Mhm.
And I think that's such an important lesson, that the third lesson that you just gave us is that family, and not every family is perfect. In fact, there are no perfect families. There are family members that you will disagree with, but there's something good to be found in that nucleus. There's something to be found in that foundation. And guess what? Family doesn't necessarily mean blood.
That's correct.
You know, even
That's
Jesus
correct.
said it, who is my mother and who's my father? But where love is,
That's it.
where love is, that place where you can find love and know that when you go there, you're home,
That's right.
and that someone
That's right.
cares about what happens to you. So
I know that we've got to wrap it up, but I can't stop with the love part. You know, like when we had this meeting with the women, and you had those mothers and fathers that were married, and that was one of the things that they were struggling with is how do I keep this together? What do I do to change the way the dynamic that sometimes my husband and I or my family and I are struggling with because we have so many priorities. We got the kids, we are
school, we
battling.
got work, we got
Oh my God.
finances, we have
This,
yeah.
that, and the other. And they didn't have a skill set
Yeah.
because so many people are single.
Love.
Right. And so so many generations have not had men in the house.
Yes.
You know, and they've been raised by others. And so we don't know how to relate, you know, to each other. So I think that part of our whole health, you know,
Start with love.
it starts with love.
Start
That's
with
the
love.
point.
So
That's the point.
it has been my pleasure to
Mine
have you
too.
here with you.
Thank you
and
for
we
inviting me.
definitely will have you coming back. And I think you brought some flyers. Did we have an empowerment coming up?
Well, you know what? This was the official
official
report
one.
that we did.
Oh, good.
And I wanted a report because I know
Nice.
that people need to be able to refer back on it. And there are strains in here that
Nice.
gives us work to do for the women, and it came from their own mouths.
Excellent.
And so
When's
this
the next
commission,
women's empowerment?
well, we are going to be having another, I don't want to call it
Jam
event.
session.
Well, you know what? Like what they call it in the Lion King, they said the pride has to gather.
Yes, so we have a
Right.
gathering of the pride.
There we
Okay,
go.
coming up.
Coming up, that's correct.
Well,
And so they are working on this right now. We have not set a date because we want to get past the summer,
okay.
but it will probably be in the fall.
Well,
whether
I'll
pride
be
or
there,
not,
I'll tell you, for sure.
And you certainly are the pride.
Well, I thank everyone for joining me with Healthy Youth. This has been a wonderful conversation with Councilwoman Wilson, and please join me next month. On the 2nd of April, we will be starting the conversation on stress management. We're going to start the conversation, be talking about different interventions that you can take to handle the stress, and then we'll meet again in May to have the mental health symposium. Don't be afraid to talk about mind, health, wellness. So thank you so much, and join me again. I'm Dr. Michelle Powell, your councilwoman for C3.